cannot move freely. This is called bronchospasm. And the result is SOB and the air moving through the tightened airway causing a whistling sound known as wheezing.
So how is respiration regulated?
Why are you hiding? How is it regulated in the body? There is a regulatory part of the brain that monitors and regulates your respiratory.
Okay. So which part of the brain is that?
Hypothalamus.
Are you sure it's hypothalamus?
No.
Where is the respiratory center in the brain?
Medulla.
Medulla?
It's located back here.
Okay. So before you find the medulla, where do you find that structure first?
The midstem of the brain.
The brain stem.
Oh,
Good.
the brain midstem.
Alright, go ahead.
Good job.
Yay, my partner! Okay, there are several risk factors that contribute to asthma. Environmental factors such as changes in temperature and humidity. They found that patients that have asthma do better in cold temperature or increased humidity. Pollutants, smoke, strong odors, for example, perfume. Chemicals, for example, household cleaners, bleaches, any aerosol spray like for dusting. Allergens, feathers, dust, animal dander, dust mites, mold, food treated with sulfites, which is like a preservative to elongate the shelf life of food. Enzymes, including those in laundry detergent, exercise, stress, or being emotionally upset. Medications such as aspirin, NSAIDs, beta blockers, and cholinergic drugs.
So if I like to, before there's strong odors, example perfume. I have asthma and I like perfume. I cannot live the day without perfume. So what would be your teaching?
Well, for each patient, it's patient-specific. Some perfumes are more abrasive to certain asthmatics than others. You just need to find the one that's pleasing to your nose that doesn't cause bronchial constriction for you. Family history of allergic disease, silent chest, which is a condition in which the indicating signs of it are extensive mucus plugging and or insufficient air movement in and out of the alveoli and the bronchs. Gastroesophageal reflux, changes in hormone fluctuation in women during periods of menstruation, and African Americans who live in inner city and are between the ages of 15 to 34 are more prone.
How would the GERD be a risk factor for asthma? The gastroesophageal reflux.
When you have GERD, that acid reflux that comes up into your airway because of anatomically where your bronchioles and your esophagus and your digestive tract meet, they all meet in the same area, so having gastric reflux close to the opening of where the lungs are causes irritation and can cause constriction.
Okay, so what structure is not functioning well in gastroesophageal reflux?
There's an overproduction of the secretions in the stomach, so you would need to use an H2 inhibitor to lower the secretions.
Why is there oversecretion of acid in the stomach in GERD?
Hyperactivity.
What is the pathophysiology of GERD as to why it
hyperactivity?
Refluxes, right?
Why
and it's hyperactivity of the secretions in the stomach.
Is it varices? Because of the varices, or the sphincter is not
adequately closing.
So what do you call a sphincter?
Cardiac sphincter.
Okay, what happens with the cardiac sphincter?
In gastroreflux, it doesn't adequately close, so the stomach contents are creeping up the esophagus.
What is the function of the cardiac sphincter?
To seal it off so that there's no backflow.
Very good. And what is the other name of the cardiac sphincter?
The one we don't know.
Oh wait,
pyloric
sphincter.
Pyloric sphincter? Pyloric sphincter? Are you sure?